this video, I'm going to show you exactly how to check your blood pressure. Did you know that even certain body movements while checking your blood pressure can raise your blood pressure, making you feel like your blood pressure is high even when it is not? So in this video, I'm going to be telling you exactly how to check your blood pressure. What are the things to do before checking your blood pressure? And what are the things not to do before checking your blood pressure? What are the things to do while checking? And what are the things not to do while checking your blood pressure? And after checking, how do you know that you have gotten the accurate reading? I'm Dr. Amirah Soni, and it is my pleasure to be back here talking to you about how to check your blood pressure. Previously, I did a video on the 10 biggest mistakes that people make concerning their blood pressure. If you have not watched it, make sure you do so after watching this video, because it is going to tell you a whole lot of things about understanding hypertension better. So let's get into it. 30 minutes before checking your blood pressure, you must not eat, drink alcohol, smoke, exercise, or take caffeine. 5 things not to do before checking your blood pressure. And then you must make sure to empty your bladder. So 30 minutes before, you do not do any of these things and you empty your bladder. This is why the best time to check your blood pressure is when you wake up early in the morning, because you would have rested for the duration of your sleep. You would not have eaten, drank alcohol, taken caffeine, do all of these things for at least 30 minutes. And then you go empty your bladder. The best time is early in the morning. And this is why it is also encouraged that you have your own blood pressure monitoring machine, also known as a sphygmomanometer, at home, so that you can use it to check at this time. Another time that is also good is at night, after you must have completed your daily activities, you have rested a bit, and it's almost time to go to sleep. That is also a good time to check your blood pressure. But you must make sure you do not do all of these things 30 minutes before you check. So now we're going to talk about how to check the blood pressure and the things to do or not to do while checking. I'll start by talking about using the right machine. You see, there's something I see all the time, especially online, that makes me laugh. I see these adverts for applications telling you to download some applications and then put your thumb on the app to check your blood pressure. Please don't do this. It will never give you the right reading. Also, this type of machine that requires that you put the cuff around your forearm is not going to give you accurate readings. The machines that you need are the ones that have cuffs that you put on your arm. So medically speaking, we call this the arm and we call this the forearm. So the arm, the cuff that you put around the arm will give you the accurate reading, not the ones that you put on the forearm. And now when we talk about the ones that we put on the arm, we have the older one that is more manual, that requires that someone puts a stethoscope in their ears to listen over your brachial artery. That is one. And then there is this one, the more modern one, that gives you a digital reading. Some of you prefer the old method. And I must tell you today that old things are not always better. And it is always important that you are open to what is new, what is easier, what is more advanced. Because when you use this method, you are depending, when you use the old method, or of course it's still in use, but I'm just trying to talk about old and new in terms of when they came about, in terms of the advancements. So when you use the old method, Your reading is dependent on who is listening to it. Is this person listening right? Do they know what the first sound they're supposed to hear is, the second down? Do they understand the physiology behind it? So it is dependent on who is listening. Whereas you have this method that checks and gives you a reading, it's not biased. So please accept to do things, the more modern way. Now it is time to check your blood pressure. You have chosen the right machine. Now you have to make sure that where you are checking your blood pressure is in a room that is not too hot, not too cold. That is very comfortable for you. Then you sit on a chair like the one I'm sitting on. You make sure that your back is against the chair, that you're leaning against the chair and your feet on the floor. You should not cross your feet. Then you should sit in this position for 5 good minutes. So you've done 30 minutes of not doing all of the things I mentioned earlier. And then you come and sit on a chair like this. You put your feet to the ground. You rest your back against the chair. And then you sit that way, not talking to anybody, nobody talking to you. No use of your phone. You sit that way for 5 good minutes. After that, you then take your machine and then you start the process. So now, how do we do this process? For the sake of this demonstration, I'm going to be making use of this. Is a device that I am selling actually. And it comes in this bag that says, Be Health Smart with Dr. Amirah. Let me show you what it contains. And this is what I expect of any machine that you're using. If you have one already, of course, do make use of it. But if you don't, you can patronize me by going through my website, www.dramirah.com, or by sending me a message through any of my social media handles. So let me show you what's inside. So you're going to find this very cute, beautiful BP monitor machine, also known as a sphygmomanometer. You're going to find this, and then you're going to find a cord, a charging cord. Many of our patients complain about getting different readings when their battery becomes low, and they have to buy batteries over and over again. And that is why I made sure that what I bring to you is something that's very useful to you. Once you charge it once, you can use it many times over. And then you have the cuff. Now that you have chosen the right machine for your blood pressure check, it is also important that you have the right cuff. So this right here is the cuff. And this cuff has a part called the bladder. The bladder is from here, using this machine, to here. From here to here. This is the bladder. And the bladder should cover at least 80% of the arm circumference for it to get the right reading. For most people, most adults, this type would be appropriate. For me, this covers even 100% of my arm circumference. But for people who are obese, they may need larger cuffs to get the accurate reading. For children, they will also need smaller size. If you use a cuff that is larger than you require, you're going to get an abnormally low reading. And if you use a cuff size that is smaller than you need, you're going to get an abnormally high reading. This is how to use this machine. Many of the other machines would be similar, but if they are different in any way, then you should check the manual that comes with yours to be sure of how to use it. Your cuff should not be over your piece of clothing. I only did this for demonstration purpose only. This rope should be at the center of your arm as described in this video and as seen in the manual that came with this device. Your cuff should be at the level of your heart. To make this easier, you should rest your arm on a table. In using the device itself, you have to set it to 1 or 2. This device is made to be used by 2 people. Say husband is 1 and wife is 2. So you have to set it to the right one before you start using it. Then you click on the on button and wait for your reading to be done.
When it's done, you'll see the value as
Thank you. Your blood
this.
pressure is
If you don't want the sound, you click on Sets, stop the voiceover.
on red and
You can click on Memory to see all of your previous readings. So if it's set to 1, you'll see all the readings for person 1. And if it is set to 2, you can see all the previous readings for person 2. So this is how to make use of this device. It is simple and helps you keep 99 readings.
It is very important to follow all of these precautions. Checking your blood pressure without relaxing, without resting your back on the chair you're sitting on, can raise your blood pressure by 10 millimeters of mercury. Also, sitting down with your legs crossed or talking to someone or them talking to you while checking your blood pressure can raise it by 10 millimeters of mercury. Having a full bladder can raise it by 10 to 15 millimeters of mercury. And smoking within 30 minutes of checking your blood pressure can raise it by as high as 20 millimeters of mercury. Checking your blood pressure without folding your clothes. Yeah, don't mind me. I had to do that because I couldn't expose my body while checking. But the ideal way to check is to roll up your sleeves and place the cuff directly on your arm. By placing the cuff over your clothing, your BP can be raised by as high as 50 millimeters of mercury. So imagine someone with a blood pressure of 120 millimeters of mercury, a systolic blood pressure of 120 millimeters of mercury can then have a reading of 170. You can imagine them then rushing to the hospital thinking that their blood pressure is high, when the reason it was high was just because they did not do the right thing. When you have checked your BP this way, you get a reading. If you are not satisfied with the reading you have gotten and you want to check your blood pressure again, you should give at least 1 minute. You should wait at least 1 minute before you check again. If you get normal value, if you get below 120/70, you don't need to bother yourself. However, if you get abnormally high readings, you should check again. Now, some people say things like, oh, I checked my BP earlier, and then when they checked it again, the maybe a 140/80 then becomes a 120/70, and then they are wondering why they are getting these readings. Yes, it's possible to have that, and it is normal to have that. So how do you know whether you have gotten your accurate reading? What you're going to do is that you'll continue to recheck your blood pressure until you get 2 readings that have a difference of just 5 millimeters of mercury between them. So say you have a reading that is 140/80, and then you have another reading that is 135/76. The difference is no more than 5. So you add this together and then take the average. That is your reading. Generally, we say a good reading is a reading if about less than 120 over less than 70 millimeters of mercury. When you have a reading like this, you can feel like, okay, yeah, this is fine. But it is not good enough to just have this kind of reading and then relax. You still have to come to the hospital. You still have to do some investigations. Together with your blood pressure check, will then be used to calculate your cardiovascular disease risk over the next 10 years. That is, your risk of having a heart problem in the next 10 years would be calculated. Based on this risk, it will then be decided whether you are just to have lifestyle changes or whether you are someone who would need certain medications. Also, you should know that the blood pressure level that we want for people can differ based on other diseases that they may have. So for someone who has diabetes, for example, the level of blood pressure that we want for this person may be different from someone with some form of kidney diseases. So it is not enough to just check your blood pressure and say, oh yeah, it's okay, it's fine. Please come to the hospital. Some may not need to come for more than once a year for other checks. And when you're fine, you can go ahead and live your daily life knowing that at least you have done right in that regard. Once again, and as always, I am Dr. Amirah Adeola Sonny, and I must tell you that I love talking to people about their health. My patients enjoy this, and I'm bringing this to you for everybody to benefit from. So what is your part in all of this? Your part is to share this message with as many people as possible, because this is a message for everybody to hear. Even people in the profession, some health workers do not even know that they're supposed to take all of these precautions while checking people's blood pressure. So please share this video with your friends, family, subscribe to my YouTube channel, follow me on all of my social media handles. I'm going to do my best to put the links below. Thank you so much. If you have anything you want me to talk about, please drop it in the comments, or any comments, suggestions, questions. I'm all ears. Do watch out for my next video.